They've actually looked at the amount of PACs you need and what formulation. So a lot of the supplements on the market will say that they're 36 milligrams of PACs, but they're like the whole berry. So they're using the skin of the berry and the stem of the berry, and that's not going to help you. So you need to make sure that the supplement you're using is a soluble form of the cranberry, and it's actually very, very effective at reducing the risk of UTIs. There is some, although not as much data, that if you're having them around sex, which some women do always have post-coital UTIs, that you can take 2 on the day of sex and 2 on the day after, and that may be helpful. So that's kind of the guidelines. Now, there's a ton of other things that you can do to help prevent that are kind of available and have some data behind them. So there's other things that people use like probiotics, but there's a lot of heterogeneity, as you know, in probiotics and what to take and are they really effective vaginally in the flora there. So those are kind of the big things. And there is actually a lot of microbiome study in UTIs going on actually at UCLA, where they're looking at the microbiome of people who are more at risk for UTIs or even overactive bladder, other conditions like that. And they're trying to figure out, like, is there something here that we can target or that we can figure out is causing problems? Because sometimes we just can't figure out why it's happening. In terms of wiping from front to back and swimming and peeing after sex, there's no good data on any of those things. Wiping from front to back, I think it does create a little bit of like shame. Like